My name is Bryan Bell. I'm a surgeon who focuses primarily on the comprehensive management of patients with head and neck cancer, as well as those requiring reconstructive jaw surgery or requiring facial reconstruction after trauma. I went to school in New Orleans at Loyola, and Ellis Marsalis was my improv teacher. And the guy that was sitting right next to me in freshman theory was Harry Connick Jr. It was an incredible time to be in music school. I realized pretty quickly that the world was better off without me playing jazz saxophone. So I went to work for my father, who was a surgeon, and dedicated myself to that and began to realize that this was something that I was very, very interested in. Well, there's no other area in the body where so many senses are in such a confined part of the body. Your ability to speak, your ability to taste, to smell, to see. In my way of thinking, there's not a more challenging part of the human body. I direct the head and neck cancer program at Providence Cancer Institute. Providence treats more cancer patients in this state than any other health system in the state of Oregon. And I'm privileged to lead a wonderful group of surgical oncologists, medical oncologists, pathologists, a bunch of different ologists, all of whom come together to take care of the most complex patients with head and neck cancer.
He has made that a mature and a high volume center, working intimately with the immuno-oncology clinicians and researchers there to offer an amazing level of care right here in Portland, Oregon.
He's been instrumental in making sure that that program has the most number of clinical trials to offer to patients with head and neck cancer. He's been instrumental in making computer surgical planning an accepted standard across the country as well as internationally. He is a leader within our specialty locally as well as nationally and internationally.
Virtually everything we deal with within the context of our practice is either life-threatening or life-altering. I believe what patients most want to know, other than are you competent, is do you care? And if a patient is in my office, I want them to know that I will treat them as they were my own family. And I think it's only through that type of relationship that you will be able to optimize patient outcomes.